Hello and welcome to Pediatric Advanced Life Support from the American Academy of CPR and First Aid. I would like to congratulate you on taking the next steps toward providing excellent survival care to your patients. In this course, you will learn how to identify cardiac arrest, how to respond appropriately, and what life-saving measures may need to be performed. You will also learn more about important electrical signals in the heart, which will help you perform the correct actions in each life-saving sequence. Finally, we will discuss the medications you may use during cardiac arrest or life-threatening medical situations, as well as acute respiratory and cardiovascular problems common in children, including asthma and shock. Saving a life might be the most important thing you do in your career. Let's learn how to perform advanced pediatric life-saving care accurately and safely. Advanced pediatric life support is performed on a continuum called the chain of survival. This chain is associated with decreased mortality in critically ill children having sudden cardiac or respiratory events. There are a few basic steps. The first is prevention. This step focuses on the timely identification of a problem and the rapid employment of an appropriate action. Many emergent conditions in children can be avoided through careful monitoring and adequate safety measures. Next is activation. This is activation of the emergency response system, which may include shouting for help, calling 911, or announcing the event over paging or intercom systems. Activation is followed by resuscitation, which is the delivery of high-quality chest compressions, ventilation, and timely defibrillation. Next, as a pediatric advanced life support provider, you will use techniques to establish an airway or administer medications. From here, post-event care begins, which is follow-up in a high-care setting of a hospital or transportation to an appropriate facility. Depending on your role, this may include transport to a local emergency department or transfer to a helicopter or higher care facility. The final stage is recovery, where healthcare providers facilitate rehabilitation and provide caregivers with resources and support. Together, these steps make up the chain of survival. This chain may change based on the location of the patient. The important thing to remember is that recognition, fast, appropriate response, and rapid defibrillation when necessary all facilitate the need for post-cardiac arrest care and/or transport. You will learn each step of this process during this course, and I'll introduce you to some key players.